Hi everyone, welcome to Today's class is going to be super short. We are going to discuss gastrointestinal tract infections. So these are the list of diseases we'll talk about. The first one is dental caries. The second one is periodontal disease, MAPS. Talk about gastric ulcers. We talk about acute diarrhea. We talk about cholera. Talk about chronic diarrhea, colitis, hepatitis A, B, and C. So the first one on our list is dental caries. This is the most common infectious disease of humans, and it's basically a dissolution of your tooth surface, which is mostly done by metabolic activities of bacteria. Then this will result in minor destruction of your enamel. So basically, you have your enamel here, and you have bacteria um, species, um, bacterial species acting metabolically on your enamel and leading you to the wearing of it, because the bacteria is basically forming biofilm and producing more of acidic environment. It degrades your enamel. The most common bacterial species Streptococcus mutans and Streptococcus subrenis. Um, Transmission is direct contact. Incidence may vary depending on how much carbohydrate you consume, your oral hygiene, and also some genetic factors. Second on our list is is periodontitis. There's basically two stages. The first one is gingivitis, which is basically the swelling or loss of contour and patchiness and some patchiness of redness, which will lead to increased bleeding. So basically, you have um you have biofilms forming on your teeth, and if left untreated, will lead to the second stage. Um, there'll be pockets which will develop between your tooth and the gingiva. So basically, gingiva is basically the tissue, the bumpy tissues between the two teeth that you have. So now that you have all these biofilms forming on your teeth and is left untreated, the bacteria will have no options but end up degrading your gingiva. So now this leads us to the second one, which is periodontitis. Basically, the extension of the gingivitis. So this time around, as I explained earlier on, the bacteria will go ahead and create more damages to your gingiva, leading to inflammation of the gingiva and eventually wearing of all of the gum closest to your teeth. Eventually, if untreated, will lead to losing of your tooth. This can also cause bone resorption. Basically, the bone present or closer to your tissue will be resolved back into your body. It's caused by polymicrobial biofilm. So you have a lot of microbes coming together forming biofilms. This often contains this group of microbes, the Tenerella, Forsticia, and also other ones that we can see here. Transmission, this is not transmissible. This solely depends on the hygiene of your of your mouth. So basically oral hygiene. Brush your teeth often, you might not encounter this. Next on our list is MAPS, which is caused by the mouse virus. Symptoms include fever, nasal discharge, muscle pain, and miliasis. And transmission is through droplet contact, and there is also MMR vaccines available for the treatment of this. The next one is gastric ulcer. Um, and there are several kinds of gastric ulcers I want us to talk about. I want us to talk about. The first one is gastritis, which is basically inflammation of your stomach lining, and which you obviously experience a very sharp and burning pain in your abdomen. The next on our list is gastric or peptic ulcers, which is basically lesions in your mucosa of your stomach and the uppermost portion of your small intestine. This is caused by Heliobacter pylori, and it affects about half of the world's population. So this is more common. Most people have gastric ulcers. Transmission is unknown and is believed to be possibly through fecal oral route or oral route in some families. Next on our list is acute diarrhea, um, which is basically when you have more than three plus stools within a day. It's caused by bacteria, virus, and protozoa. Some of them include Salmonella, Shigella, E. coli, and the list goes on and on. Transmission is through fecal, oral, or foodborne transmission. There are antibiotics available for this, but the disadvantage is that the antibiotic resistance for acute diarrhea is increasing, and now it's becoming quite a bit challenging to deal with this. So now let's talk about of the individual each of the individual causative organisms for acute diarrhea. First one on our list is Salmonella enterica, which causes. Oh no, no, we are not going to talk about each individual. So we are moving to the next disease, which is salmonellosis, which is caused by Salmonella enterica. This is a gram-negative enteric organism which high which have high ID. Basically, you just need few of them to cause an infection. Transmission is through fecal oral route or foodborne. Symptoms include about 1.2 million cases and 500 deaths per year if it's left untreated. We have enteric fever or gastroenteritis, which ranges from mild diarrhea to fever. And in some stereotypes, you have enteritis, and the list goes on and on. And if left, and the second part includes you having a typhoid fever, which is kind of more common. Um, it's very progressive and it invasively infect your intestines and eventually leads to septicemia, which is characterized by fever, diarrhea, and abdominal pain. So, if left untreated, you might have holes within your intestines. Next on our list is Shigella, which causes shigellosis. It's a gram-negative bacteria. It's a gram-negative bacteria, and then it's a gram-negative bacteria, and we have the different strains of Shigella that causes this. Have Shigella distin dysentery, and then we have Shigella sonnei, and all of them causes the shigellosis. These are also low ID species. Transmission is through fecal, oral, and direct contact. Basically, this species releases the Shiga toxin or Shiga enterotoxin, which goes in there and damages your GI tract. And as you can see, this is how normal GI tract look like. And when you get shigellosis, you have basically bleeding GI tract. Symptoms include frequent and watery stool, fever, and intensive abdominal pain. You also experience nausea and vomiting, which is very common. And then in worst cases, you have the dysentery, which is basically diarrhea containing blood. And this is as a result of holes created in your intestine and blood is all leaking out. And as you can clearly see here, there are some holes created in the patient's intestine. So now let's talk about Shiga toxin producing E. coli. This is a specific E. coli strain which we term as E. coli 0157H7. Um, their toxin that they produce is identical to that of the Shiga toxin we talked about earlier on. Their transmission is through fecal oral route or foodborne, and in some cases, we have when you have an uncooked meat. Symptoms include you having a range of mild gastroenteritis to fever with bloody diarrhea. And we also have the hemolytic uremic syndrome. Basically, you having severe hemolytic anemia that can cause kidney disease and failure. So just be careful of eating raw meat. If you are into eating of raw meat, just be careful. Next on our list, we have Campylobacter. Most common cause um is the most common cause of bacterial diarrhea that we have. Transmission is through oral and foodborne. And then symptoms include frequent watery stool, fever, vomiting, headache, and also severe abdominal pain. They are slender and curvy and spiral gram-negative bacteria, as we can clearly see in this image. And inhabit inhabit the intestines and your GI tracts and also oral cavity of animals and both humans, and basically leading to the causative of Guillain-Barré syndrome and causes severe damages to your GI tract. Next animal that causes diarrhea on our list is now sorry, next microbe that causes diarrhea on our list is called Cryptosporidium. This is basically an intestinal protozoan. The cyst is highly infectious and resistant to chlorine treatment, and symptoms of you getting infected with this parasite include of this protozoan include headache, sweating, vomiting, and severe abdominal cramps. Transmission is through water, food, and you also have fecal oral route, and also outbreaks are being associated with people. Outbreak have been associated with swimming pool. So if you have people who play a lot in dirty swimming pool, they might run a risk of getting this. Next on our list is norovirus. This is the most common viral cause of foodborne disease in the US. Transmission is also similar, fecal, oral, food, or waterborne. Symptoms will include profuse watery diarrhea for 3 to 5 days, and you have vomiting in early stages and also mild fever. This is also a low ID, so you just need about 1 to 20 virus to cause a severe infection. Many outbreaks are associated with cruise ship, and then bear in mind this is not the one that we had recently. So next on our list is rotavirus, which is a primary cause of morbidity and or mortality resulting from diarrhea worldwide. So about 50% of diarrhea cases, you have rotavirus involved in it. The same transmission, fecal oral route, including contaminated food, water, and formite. It's generally mild, except when you have infants 6 to 24, which they experience severe forms of this. But thankfully, we have the Rotatech, which is a oral live viral vaccine, which you can take to protect yourself against this. Next on our list is pseudo membranous colitis, which is basically is caused by the Clostridium difficile. It's a gram-positive and endospore forming bacteria, and it's basically a normal biota of the intestine. Transmission is through precipitated by broad spectrum antibiotics. So, yeah, the bacteria secrete enterotoxin A and B, which basically form necrosis in the wall of the intestine. So, as you can clearly see, these are some of the necrosis present in a person infected with this microbe in their intestine. Next on our list is cholera, which is caused by Vibrio cholera. It's just a comma-shaped robbed bacterium, and as you can clearly see, this is how they look like. Symptom is through water and fecal oral transmission. You experience vomiting in the first few symptoms, and then you experience also some rice waters too, which is continuous uh, continuous basically pooping. You end up losing a lot of blood, and then you also in some cases you experience hypertension. You also experience um, tachy, um, tachycardia symptoms. You also have some cyanosis, and in some cases, if left untreated, you have about 50 to 70% mortality rate. And then basically, the pathogen releases the cholera toxin, which also infects your GI tract. We have chronic diarrhea, which is when you have diarrhea over 14 days. This can be infectious and also can be non-infectious cause. So you experience an irritable bowel syndrome, and also you have ulcerative colitis. And when you have patients who have AIDS, they all universally suffer from this chronic diarrhea. If you have a patient infected patient, if you have an AIDS infected patient. The microbes in these groups cause chronic diarrhea in otherwise also in healthy people too. So it's just that each patient experience this in the worst case scenario, but for healthy people, it's less of a problem. Next on our list is giardiasis, which is caused by Giardia lamblia, which is a flagellated protozoan. So normal protozoan, and then they have flagella, which helps them move effectively. Symptoms include diarrhea of long duration, abdominal pain, and flatulence. And you also have some greasy and mudderous stools. Transmission is through vehicle. You also have fecal oral route. Direct and also indirect contact will lead to transmission. Giardiasis, and you have this is a complex epidemiology. It have a complex epidemiology pattern. Basically, you is mostly isolated from beavers, cows, coyote, and you have humans are also carriers. So now, as you can clearly see, human consumes it, goes into the human, and then the cysts will now grow, and then producing a grown form of the bacteria of the parasite. The parasite stays within you, and now here, through feces, the human can also release back the cyst into the environment, and the cycle goes on and on. The cyst can survive up to 2 months in the environment. The epidemic traces to water from mountainous stream as well as chlorinated municipal water. So please, if you are someone who goes for hiking, just be careful you don't pass to in the forest or closer to water bodies. Should in case you have these cysts in you, you end up transmitting it to other people. Next on our list is entamoeba histolytica. So transmission is through vehicle, fecal oral route, food, or water with cysts in it, obviously. Humans serve as the primary host. This parasite or this microorganism targets your cecum, and the goal is that they target your cecum, appendix, column, and the rectum, and then they actively penetrate the deeper layers of your mucosa. Symptoms include you having dysentery, basically bloody stool, and you have mucus filled stool too. You experience abdominal pain, diarrhea, and fever, and also weight loss. When left untreated, this can lead to hemorrhages and perforation in your GI tract, and in some cases, you have appendicitis and also amoebomas. And this is the life cycle of the microorganism. From this trovozoite state, it moves to mature cyst, and then it goes into a cystisment, and then it goes back again just to reproduce more of itself. Next on our list is hepatitis, which is an inflammatory disease of the liver. You experience necrosis of hepatocytes in your liver, and then this you receive a response by your white blood cells that swells and disrupts your liver architecture. Interferes This interferes with the excretion of your bile pigment, leading to bilirubin accumulation in your blood and tissues, which causes jaundice. Basically, you will see it with your yellowness of your, you see the yellowness of your eyes, and that gives you an idea that you have jaundice. There are three types. Um, there are three types of hepatitis, which ranges from five types of A to E. So now let's talk about the hepatitis A, caused by hepatitis A virus. Symptoms include subclinical or vague, and then you also experience flu-like symptoms. And then you have, in some cases, you have jaundice, which is more present in 10% of all cases of hepatitis A. Transmission is through the fecal oral route, and we have the Hep A vaccine, which you can take to protect yourself. Next on our list is Hep B or hepatitis B. It's caused by the hepatitis B virus. You experience fever, malaise. You also experience abdominal pain, diarrhea. Sometimes you have rashes on your skin, and this disease can also become chronic. It can also become a chronic liver disease, which is a cause of the hepatocellular carcinoma, basically cancer in your liver. Transmission is through parental basically blood contact, and you also have a direct contact through sexual activity. and you can also have a vertical transmission. But it's great, and thank God that we have hepatitis V vaccine to protect us against this. And this is a progression that can occur with HBV or HVC. So you have a healthy liver, and then when you get infected with any of these viruses, you're going to lead to fibrotic liver, and then from there you move to cirrhotic life, and then eventually you land in the liver cancer zone, which is mostly a fatal zone if you don't get a liver transplant. Next on our list is hepatitis C, which is caused by hepatitis C virus. This is this is a silent epidemic disease. About 3.5 million Americans get infected, and you have years until your symptoms show up. So you have it, but you won't see it. It's very silent until several years later on. You have similar symptoms as the hepatitis V virus. You have 70 to 85% infected infections leading to indefinite chronic disease, and then it also causes hepatocellular carcinoma. Transmission is through parental or blood contact, and also vertical. And if you have blood transfusions and also you share needles with people, you have to be careful because you have your blood. Once an infected person's blood gets onto your skin or gets into your blood, there's no way you can reverse this. The thing is, there's no vaccine available for this, so you have to be careful out there. This is basically all I have for you for today. Today's lecture is super short. Hope to see you on Wednesday to share another lecture with you. Okay, bye.